This is the competency video for surgical aseptic gloving. The first thing that you're going to do is to come over and have a clean package of gloves. You're going to open up the gloves and you can get rid of the outer package. That's no problem. You can touch the outside of the package. It's not sterile. So the first thing that you're going to do is open up the package. And you want to make sure that you don't go beyond a 1-inch border when you open up that package. So see how this is kind of has a cuff that's folded over and it's about 1 inch. So you're going to open up the package and you have to be really careful because you don't want your gloves to flip over while doing that. You can't touch anywhere on here other than that folded 1-inch corner. And you want to make sure that your gloves stay open because this is going to become your sterile field. After your gloves are open, what you're going to do, and this is the only hand wash I let you fake, is your surgical aseptic hand wash. So you'll step to the side, even though you can still see your gloves in sight. So you'll kind of step to the side and pretend like we have a sink here, and you'll do a pretend surgical aseptic hand wash. And again, this is the only hand wash I allow you to simulate or to fake. This is it. Any other time I tell you to wash your hands, you need to go over there and wash your hands. So I can still see my sterile field. I simulated my sterile or my surgical aseptic hand wash. I'm going to step back in front of my gloves with my hands upward because after surgical aseptic, hands stay up. Now what I'm going to do is I'm going to reach down and I'm going to pick up the first glove. I can touch this cuff. I cannot touch the paper. I can't touch anything else. So I'm going to take this glove and I need to pick it up and off of the paper. Okay? So that it's not, I'm not trying to put my hand down here into the glove. This hand needs to stay up as I put this glove on. So I need to pick this glove up and put it in an upward motion. Now, I can touch anywhere on this cuff. If this cuff starts to roll, I can come back here and touch, but I cannot touch the sterile part of the glove. This cuff is going to touch my hand, so it's no big deal if I touch it because it's eventually going to be turned down onto my skin, which will make it sterile. So see how my wrists are staying above my elbows? I'm staying away from my sterile field, and I'm putting this glove on in a sterile manner. Now I have one sterile hand, one non-sterile hand. So I need to pick up my second glove. The way I do this is I'm going to take my sterile gloved hand and I can touch sterile to sterile, so I can touch this part of the glove, but I cannot touch the cuff like I did the first time. So you might want to come to the side. Okay. So now what I need to do is I need to pull my fingers underneath here. I cannot use my thumb because again I cannot touch this part. I can only touch sterile to sterile. I'm going to use these fingers to get into that cuff without going beyond my 1-inch border. And as soon as I have a good grip on that glove, I'm going to pull it up and off, okay? Because again, these hands need to stay up. I cannot use my thumb to help. Get that thumb away because that thumb is sterile and this isn't considered non-sterile. So now, again, in an upward motion, I'm going to put this glove on my hand. Okay, now you saw my thumb didn't quite go in there. Let's say, for instance, if I put it on, my fingers get caught like this. On the second glove, that's okay because now this is sterile and this is sterile and I can come over here and help them fix each other out. Okay, all right, so I can't pull down like this because my arm is not sterile and my thumb is. I can't pull like that, but I can take this and I can pull it down. Okay, so you have to remember sterile to sterile, non-sterile to non-sterile. You can't go sterile to non-sterile, all right? So now I have my gloves on, and I'm not going to drop my hands because I'm going to assist the physician, so you have to keep your hands up at all times when you have your sterile gloves on. Now, let's say I'm finished with my procedure. What I need to do is remove my gloves. So the first thing I'm going to do, or my hands are going to go down and right in front of me. Not out here, but down. Okay, because as I pull these off, if something goes flying, it goes flying towards the floor. It doesn't go flying towards one of my coworkers. Okay, so the first thing I need to do is grab the palm. Do not grab the wrist because now my hand is full of blood or guts or whatever may be on there, and I don't want to touch that to my skin. So I want to grab the palm, and I'm going to pull that glove off. It's got to come off inside out. Sometimes you may need to cross your fingers so it comes off inside out. If it does not, then we have a problem. So the glove needs to be totally inside out. Then you're going to wad it up in the hand that has a glove on it. Now I'm gonna go across down my skin because now my hand is clean because it was protected by the glove. So I'm gonna go across. I'm not gonna grab down here. I'm not gonna grab like this because I don't want my unprotected fingers to get near the contaminated material. And again, this glove needs to come off inside out as well. Now, all the contaminants are innermost when I take my gloves off that way, and now my gloves would go in biohazard container.